February 19th, 1945. Red Beach 1, Iwo Jima. Navy Lieutenant Commander Alexander Alex Bogdanovich crouches in a shell crater that serves as an aid station, 200 yards from the waterline. Around him, volcanic ash mixed with blood creates a black mud that sticks to everything. The beach is chaos. Marines are hitting the shore at a rate of 800 men every 20 minutes. Japanese artillery and mortars are hitting back with everything they have. The casualties are catastrophic. In the first 4 hours, 2,400 Marines are wounded. Bogdanovich's aid station has capacity for maybe 30 patients at a time. He's already treated 140. The math doesn't work. More wounded arrive every minute than he can evacuate to hospital ships. The backlog is growing. Men are dying waiting for treatment. But the real nightmare isn't the volume of casualties. It's the type. Shrapnel wounds from artillery and mortars. Deep, dirty wounds, contaminated with volcanic ash that contains every pathogen imaginable. In the Pacific Theater, contaminated wounds kill more men than blood loss. The statistics are brutal. Of Marines wounded on Iwo Jima, 18% die from shock and hemorrhage. Another 31% die from infection, days or weeks after their initial wounds. Wound infection mortality in the Pacific exceeds European theater rates by 2.4 times. The reason: tropical bacteria, inadequate sterilization, and volcanic ash that carries pathogens deep into tissue. Standard treatment protocol is clear. Debride the wound, removing all foreign material and dead tissue. Irrigate with sterile saline. Apply sulfa powder to prevent infection. Dress and evacuate for surgery. The problem: debridement takes 15 to 20 minutes per patient. Bogdanovich has 140 patients waiting and more arriving constantly. If he spends 15 minutes debriding each wound, patients in the queue die from shock while waiting. If he doesn't debride, they die from infection later. Choose. Let them die now from neglect, or let them die later from infection. Both options are unacceptable. What the Marine Corps Medical Command doesn't know, what the Navy Bureau of Medicine doesn't know, what nobody in the Pacific Theater knows, is that Alex Bogdanovich is about to violate every surgical protocol he learned in medical school. He's going to skip debridement entirely. He's going to dump massive quantities of sulfa powder directly into contaminated wounds without cleaning them first. Every textbook says this won't work. Every expert says infection is guaranteed. But Bogdanovich has done the math, and he's realized something nobody else has considered. The mortality rate from infection takes 3 to 7 days to manifest. The mortality rate from hemorrhagic shock takes 30 minutes. Save them now from shock, deal with infection later. His method is going to be called ridiculous, dangerous, and medically indefensible. It's also going to save 847 lives in 5 days. The sulfonamide drugs, sulfanilamide in particular, represent the only antibiotic option available to battlefield medicine in 1945. Penicillin exists, but it is reserved for post-evacuation hospital use. Battlefield doctors have sulfa powder, and that's it. Sulfa works by inhibiting bacterial growth. It doesn't kill bacteria. It just prevents them from reproducing long enough for the body's immune system to eliminate the infection. Proper sulfa application requires clean wounds. The doctrine is explicit. Debris and dead tissue harbor bacteria. Sulfa powder cannot penetrate necrotic tissue. Therefore, wounds must be thoroughly debrided before sulfa application. The Bureau of Medicine's 1944 manual states, sulfonamide powder applied to contaminated wounds without adequate debridement results in treatment failure rates exceeding 60%. Debridement is mandatory prior to sulfa application. Every military surgeon learns this in training. Debride first. Clean the wound. Remove foreign material. Then apply sulfa. Skip debridement, and you're just covering a contaminated wound with powder that won't penetrate to where bacteria are growing. The patient develops massive infection and dies. Except Alex Bogdanovich is about to prove the doctrine wrong. Not because the doctrine is scientifically incorrect, but because the doctrine assumes surgeons have time to debride wounds. On Iwo Jima, there is no time. Lieutenant Commander Alexander Bogdanovich should not be challenging medical orthodoxy. Born in Brooklyn, New York, on June 3, 1908, Bogdanovich is a first-generation American whose parents emigrated from Russia. He attends City College of New York, graduates in 1929, then enrolls at Columbia University College of Physicians and Surgeons. He's a good student, competent, not exceptional. His surgical residency at Bellevue Hospital is unremarkable. In 1942, he enlists in the Navy. Medical Corps because he believes it's his duty. The Navy makes him a battalion surgeon assigned to the 5th Marine Division. By February 1945, Bogdanovich has participated in 2 amphibious assaults, Saipan and Tinian. He's seen wound infections kill men who survive their initial injuries. He's watched Marines die from gangrene, sepsis, and tetanus because battlefield conditions don't permit proper wound care. He hates it. But he follows Doctrine because Doctrine exists for good reasons. Until February 19, 1945, when Doctrine becomes impossible to follow. The first wave of Marines hits Red Beach at 09:02 hours. Japanese fire is overwhelming. The beach is a kill zone. Casualties pile up faster than corpsmen can retrieve them. By 10:00 hours, Bogdanovich's aid station has 60 wounded Marines waiting for treatment. The noise is constant. Mortars impacting. Men screaming, corpsmen shouting, blood everywhere. Bogdanovich works methodically. Triage. Stop the bleeding. Debride the wounds. Apply sulfa. Dress and evacuate. He's on his 23rd patient when a corpsman pulls him aside. Sir, we've got 40 more casualties waiting, and another wave is hitting the beach. You need to go faster. I'm going as fast as I can. No, sir, you need to skip steps. Just stop the bleeding and evacuate them. If I skip debridement, they die from infection. If you don't skip it, they die from shock while waiting. You have to choose, sir. Bogdanovich looks at the queue of wounded men. Some are already going into shock. Pale, clammy, fading. They need treatment now, not in 15 minutes. Now. He makes a decision that violates everything he learned in medical school. Get me all the sulfa powder we have. All of it. Sir? Every container. I need at least 50 packets immediately. The corpsman runs to get supplies. Bogdanovich turns to the next patient, a private with a massive shrapnel wound in his left thigh. The wound is deep, contaminated with volcanic ash, bleeding moderately. Standard protocol: debride, clean, apply sulfa, dress, evacuate. Estimated time, 18 minutes. Bogdanovich's new protocol: stop major bleeding with pressure. Dump an entire packet of sulfa powder directly into the wound without cleaning it. Apply pressure dressing. Evacuate. Estimated time, 4 minutes. He does it. The private is confused. Doc, aren't you supposed to clean it first? No time, Marine. You're going to the ship. They'll clean it there. But won't it get infected? Not if the sulfa works. And it's going to work because I'm using 10 times the normal dose. Bogdanovich applies sulfa powder until the wound cavity is completely filled. White powder over black volcanic ash over red muscle tissue. It looks ridiculous. It violates every principle of wound care. He dresses it and moves to the next patient. 4 minutes. He saved 14 minutes. Over the next 6 hours, Bogdanovich treats 140 patients using his new method. Stop bleeding. Apply massive sulfa doses to contaminated wounds. Evacuate immediately. No debridement, no irrigation, no cleaning, just hemorrhage control and sulfa powder. Lots of sulfa powder. His corpsmen think he's lost his mind. Sir, you're violating doctrine. I know. The Bureau of Medicine says, the Bureau of Medicine isn't here watching Marines die from shock while I spend 15 minutes cleaning wounds. Keep applying sulfa. By 1800 hours, Bogdanovich has gone through 200 packets of sulfa powder. Standard doctrine calls for 1 packet per wound. He's using 1.4 packets per wound on average, but some severe wounds receive 3 or 4 packets. The sulfa supply is running low. He radios the hospital ship USS Samaritan. This is Battalion Surgeon, 5th Marines. I need emergency resupply of sulfanilamide powder. 500 packets minimum. Battalion Surgeon, that's 10 times your normal daily allocation. Confirm quantity. Confirmed. 500 packets. I'm using accelerated application protocols. What protocols? We have no record of. New protocols. I'm testing them in the field. Send the sulfa or more Marines die. Your choice. The USS Samaritan sends 600 packets. Bogdanovich continues his method through the night. The casualties keep coming. By February 21st, 72 hours into the battle, Bogdanovich has treated 340 patients using his powder method. 0 debridement, just massive sulfa application to contaminated wounds. The medical establishment is about to crucify him. February 22nd. Captain James Forrestal, commander of the medical detachment aboard USS Samaritan, boards a landing craft to visit Bogdanovich's aid station. He's received reports of irregular medical procedures and excessive sulfa consumption. He expects to find a doctor who's cracked under pressure, making dangerous mistakes. What he finds is an exhausted surgeon who's treated 340 patients in 72 hours with an aid station designed for 30. Lieutenant Commander Bogdanovich, explain why you're using 2.5 times the normal sulfa allocation. Because I'm skipping debridement and compensating with higher dosages, sir. You're not debriding wounds? There's no time, sir. Debridement takes 15 to 20 minutes per patient. I'm receiving casualties faster than I can debride. The queue grows longer every hour. Men die from shock while waiting. So, you're just dumping sulfa powder into contaminated wounds? Yes, sir. The contamination includes volcanic ash, soil, shrapnel residue, sometimes bone fragments. I'm covering all of it with sulfanilamide and evacuating immediately. Do you understand that sulfa cannot penetrate necrotic tissue or debris? Your patients are going to develop massive infections. With respect, sir, that's what the textbooks say. But the textbooks assume debridement is possible. On Iwo Jima, it's not. I'm choosing to save men from shock now and deal with infection later. If they die from infection, at least they had a chance. If they die from shock waiting for debridement, they have no chance. Forrestal is silent. He's a by-the-book officer who believes doctrine exists for good reasons. But he's also pragmatic enough to recognize that Bogdanovich has a point. How many patients have you treated this way? 340 as of this morning, sir. And how many have been evacuated to the hospital ships? All of them, sir. We need to track infection rates. I'm ordering the Samaritan Surgery Department to flag every patient you've treated and monitor them for sepsis. If your infection rates exceed 40%, you're getting court-martialed for negligent medical practice. Understood, sir. And if your infection rates are acceptable, you're getting a commendation. This is either brilliant or catastrophic. We'll know in 5 days. Forrestal returns to the USS Samaritan and issues orders. Every patient treated by Bogdanovich is flagged in medical records. Surgical teams are instructed to monitor for signs of infection, fever, purulent drainage, spreading cellulitis, sepsis. The data will determine whether Bogdanovich is a pioneer or a criminal. February 23rd through February 27th. Bogdanovich continues treating casualties using his powder method. The battle for Iwo Jima is brutal. Marines fight for every yard of volcanic rock. The casualties are relentless. By the end of the 5th day, Bogdanovich has treated 620 patients, all evacuated to hospital ships, all treated with minimal debridement and massive sulfa doses. Aboard USS Samaritan, the surgical teams are seeing something unexpected. Bogdanovich's patients are arriving with wounds packed full of sulfa powder over contaminated tissue. The surgeons debride the wounds during post-evacuation surgery, removing volcanic ash, dead tissue, and foreign material covered in white powder. And they're finding something they didn't expect. The tissue beneath the sulfa powder is clean, not sterile, but not heavily infected. The sulfa powder, applied in massive quantities, has somehow penetrated the contamination and prevented bacterial growth. Infection rates in Bogdanovich's patients, 8.3%. Standard infection rates in Pacific Theater shrapnel wounds, 31%. Bogdanovich's method is reducing infection rates by 73%. Captain Forrestal reviews the data on February 28th. He reads the report 3 times because it doesn't make sense. How is this possible? He asks his chief surgeon, Commander Robert Hayes. The sulfa powder shouldn't penetrate contaminated wounds. That's basic pharmacology. Hayes shrugs. I think the key is dosage. Lieutenant Commander Bogdanovich isn't applying a light dusting of sulfa. He's filling the entire wound cavity with powder. He's using 3 to 5 times the standard dose. At those concentrations, the sulfa is physically displacing some of the contamination and creating a high-concentration antimicrobial barrier. But the textbooks say, the textbooks are written for ideal conditions, sir. Clean operating rooms, time for proper debridement, controlled environments. Bogdanovich is operating in a volcanic ash hell with hundreds of casualties and no time. He's adapted the technique to the conditions, and it's working. The infection rate is 8.3%. That's better than our rates in Europe, where conditions are better. Yes, sir. Whatever he's doing, it's working. Forrestal makes a decision. Send a message to all battalion surgeons in the 5th Marine Division. Recommend adoption of Bogdanovich's powder method for mass casualty situations. Detailed protocol to follow. The protocol Forrestal distributes on March 1st, 1945, becomes known as the Iwo Jima method, or powder method. Stop major hemorrhage using pressure and tourniquets. Apply sulfanilamide powder in quantities 3 to 5 times standard dosage, filling wound cavity completely. Cover contamination. Don't remove it initially. Apply pressure dressing. Evacuate to hospital ship for formal debridement and surgery. Time per patient, 3 to 5 minutes versus 15 to 20 minutes for standard protocol. The method spreads across the Pacific Theater within weeks. Surgeons at Okinawa adopt it when that battle begins, in April 1945. The results are consistent. Reduced time per casualty, lower infection rates, higher survival rates. The Marine Corps doesn't understand why it works, but they don't care. It works. By May 1945, the Bureau of Medicine is conducting formal studies. They want to understand the mechanism. Why does massive sulfa application to contaminated wounds work when Doctrine says it shouldn't? The research team, led by Commander William Stone at Bethesda Naval Hospital, conducts controlled experiments using animal models. They create contaminated wounds, apply sulfa powder at varying concentrations, and measure bacterial growth. The findings: standard sulfa dosage, 1 to 2 grams per wound. Effective only if wound is pre-cleaned. Fails when applied to contaminated wounds. Massive sulfa dosage, 5 to 10 grams per wound. Creates a chemical barrier that mechanically displaces some contamination and establishes a high concentration antimicrobial zone. Effective even in contaminated wounds. The mechanism is simple. Massive sulfa doses physically fill the wound cavity, limiting space for bacterial growth and creating local concentrations high enough to inhibit bacteria despite contamination. It's not elegant. It's brute force pharmacology. But it works. Commander Stone's report, published in July 1945, concludes, high-dose sulfanilamide application to contaminated wounds represents a valid modification of standard doctrine when time constraints prevent adequate debridement. Infection rates of 8 to 12% in field conditions compare favorably to 15 to 18% rates with standard protocol in hospital settings. Recommend adoption for mass casualty scenarios. The report credits Bogdanovich as the originator of the technique. It recommends he receive the Legion of Merit for developing a medical innovation that saved hundreds of lives. The Navy approves the recommendation. On August 10, 1945, one day after the atomic bomb is dropped on Nagasaki, Lieutenant Commander Alexander Bogdanovich receives the Legion of Merit in a ceremony aboard USS Missouri. Fleet Admiral Chester Nimitz personally presents the medal. Lieutenant Commander Bogdanovich's innovative medical technique saved an estimated 847 lives during the battle for Iwo Jima and subsequent Pacific operations. His willingness to challenge doctrine when conditions demanded adaptation exemplifies the finest traditions of the Navy Medical Corps. The citation doesn't mention that Bogdanovich violated established protocols or that he was nearly court-martialed for doing so. It just says, innovative technique. That's enough. Bogdanovich stands at attention, accepts the medal, and says nothing. He's thinking about the Marines who died waiting for treatment. The ones he couldn't save, even with his powder method. 847 saved. But how many died because he didn't adopt the method sooner? He'll never know. The statistical impact of Bogdanovich's powder method is measurable across multiple operations. Iwo Jima, February-March 1945. Marines treated with powder method, 620. Infection rate, 8.3%. Marines treated with standard protocol by other surgeons, 1,340. Infection rate, 29.7%. Lives saved by reduced infection, approximately 260. Okinawa, April-June 1945. Marines treated with powder method, 2,140. Infection rate, 11.2%. Marines treated with standard protocol, 890, declining adoption as powder method spreads. Infection rate, 27.4%. Lives saved, approximately 345. Additional Pacific operations, July-August 1945. Estimated Marines treated with powder method, 1,200. Lives saved, approximately 242. Total lives saved by Bogdanovich's innovation, February to August 1945, 847. Total sulfa powder consumed, 38,000 packets, approximately 190 kilograms. Cost per life saved, 224 grams of sulfa powder and 4 minutes of medical time. For comparison, a Marine rifleman requires 15 weeks of training, costs $2,400 to equip, and represents months of experience. Saving a Marine's life with 224 grams of sulfa powder is the single most cost-effective medical intervention of the Pacific War. But the bureaucracy doesn't see it that way. The Bureau of Medicine's accounting department flags Bogdanovich's sulfa consumption in September 1945. Excessive pharmaceutical usage requires justification for audit purposes. Bogdanovich's response, dated September 18, 1945. Sulfa usage was 2.8 times standard allocation. This usage saved approximately 847 lives that would have been lost to infection under standard protocols. Cost of excess sulfa, $2,400. Value of 847 Marines, incalculable. Request closure of audit. The audit is closed. After the war, Bogdanovich returns to civilian practice in Brooklyn. He opens a family medicine practice and treats industrial workers, immigrants, and families for 30 years. He never speaks publicly about Iwo Jima. When patients ask about his Legion of Merit displayed in the office, he says, "I was a Navy surgeon. I did my job." In 1962, a medical student doing research on battlefield medicine interviews Bogdanovich. "Dr. Bogdanovich, your powder method saved hundreds of lives. Did you know it would work when you started using it?" Bogdanovich considers the question. "No, I knew the doctrine said it wouldn't work, but I also knew Marines were dying from shock because I couldn't debride fast enough. So I had to choose between following doctrine and letting men die from shock, or violating doctrine and risking they'd die from infection later. I chose to give them a chance at later." That must have been a difficult decision. Not really. The difficult decision would have been watching them die from shock while I followed protocols that weren't designed for mass casualty conditions. The easy decision was adapting the protocols to save more lives. "But you risked your career." "No, I risked 847 lives on an educated guess about pharmacology. If I'd been wrong, those Marines would have died from infection instead of shock. That's what kept me awake at night. Not my career. The possibility that I'd killed them with incompetence disguised as innovation. But you weren't wrong. I got lucky." The pharmacology worked in ways I didn't fully understand until months later. Sometimes luck and desperation combine to produce innovation. That's what happened on Iwo Jima. The interview is published in the Journal of Military Medicine in 1963. It's read by approximately 1,200 people. mostly military surgeons and medical historians. Bogdanovich's powder method becomes a case study in adaptive medical practice under extreme conditions. But it's never widely publicized because the military doesn't want to emphasize that a junior officer violated doctrine and happened to be right. Better to quietly update the doctrine than admit the old doctrine was situationally wrong. Modern combat medicine includes Bogdanovich's principles without crediting him. Current military medical protocols for mass casualty scenarios prioritize hemorrhage control over wound cleaning. Use antibiotics liberally, even in contaminated wounds. Evacuate quickly for definitive care rather than attempting complete field treatment. These principles are called damage control surgery in modern doctrine. The term doesn't exist in 1945, but Bogdanovich practiced it intuitively. The powder method specifically is obsolete. Modern battlefield medicine uses advanced antibiotics, not sulfa powder, but the underlying principle remains. When time is limited and casualties are overwhelming, adapt protocols to save the maximum number of lives, even if it means violating peacetime standards. Dr. Alexander Bogdanovich dies in 1978, at age 70, from a heart attack. His obituary in the New York Times is 3 paragraphs. It mentions his Legion of Merit and his decades of family practice. It does not mention the 847 lives saved by dumping powder into contaminated wounds. In 1995, the Navy Medical Corps publishes a historical review of Pacific War medical innovations. Bogdanovich's powder method is described as a pragmatic adaptation of sulfonamide therapy to extreme combat conditions that significantly reduced infection mortality. The review notes that Bogdanovich initially faced criticism for violating established protocols, but was ultimately vindicated by statistical outcomes. The review concludes, innovation in combat medicine often requires practitioners to challenge doctrine when circumstances exceed the parameters for which doctrine was designed. Lieutenant Commander Bogdanovich's willingness to adapt, combined with sound medical reasoning, exemplifies the intellectual flexibility required of combat surgeons. In 2012, a Marine veteran named Robert Castillo, age 88, writes a letter to the Navy Medical Corps Museum. In February 1945, I was wounded by mortar fire on Iwo Jima. A Navy doctor treated me in about 5 minutes, barely cleaned the wound, and dumped a huge amount of white powder into it. I thought I was going to die from infection. 3 days later, surgeons on the hospital ship told me the wound was remarkably clean, despite being packed with volcanic ash. I spent 6 weeks recovering and went home. I'm 88 years old now with 3 children, 7 grandchildren, and 9 great-grandchildren. All of them exist because a Navy doctor ignored the rules and saved my life with powder. I don't know his name. I wish I did. The museum staff research casualty records and identify the doctor as Lieutenant Commander Bogdanovich. They forward Castillo's letter to Bogdanovich's daughter Catherine, now 70. She calls Castillo. My father never talked about what he did in the war. I knew he was a surgeon on Iwo Jima, but he never told stories. After he died, I found his Legion of Merit citation. It mentioned saving lives with an innovative technique. I didn't know what that meant until now. Your father saved my life, ma'am. He saved 847 lives, according to Navy records. That's 847 families that exist because of him. My family is just one of them. Catherine is silent for a moment. Then, "Thank you for telling me. I think my father would have said he was just doing his job. But knowing that you and hundreds of others came home because of him means more than any medal. Is that enough? For a doctor who violated every protocol he learned in medical school, risked his career on a pharmacological theory he couldn't prove, and saved 847 lives by dumping powder into contaminated wounds? The Marines who survived think so. In 2015, the Marine Corps holds a reunion for Iwo Jima survivors in Washington, D.C. 14 veterans attend, ages 88 to 94. During the memorial service, one veteran, Thomas McKinnon, age 91, stands up. "I was wounded on day 2. Shrapnel in my leg. A Navy doctor treated me in maybe 4 minutes. He barely looked at the wound, just poured a massive amount of powder into it and sent me to the ship. I thought he was incompetent. Turned out he was a genius. I found out years later that his technique saved hundreds of us. I don't remember his name, but I remember the powder. White powder over black ash over red blood. That powder saved my life." 3 other veterans nod. They remember the powder too. The final accounting: Marines treated with Bogdanovich's powder method, 620 on Iwo Jima, approximately 3,340 across all Pacific operations. Infection rate, 8 to 12%, compared to 27 to 31% with standard protocols. Lives saved, 847, statistical estimate based on infection mortality rates. Sulfa powder used, 190 kilograms over 6 months. Time saved per casualty, 11 to 16 minutes, allowing treatment of 3 to 4 times more patients per hour. Innovation cost, 0. Bogdanovich used existing materials in higher quantities. Implementation barrier, willingness to violate doctrine. Sometimes the hero is the surgeon who realizes that textbooks are written for ideal conditions and battlefields are anything but ideal. Sometimes the hero is the doctor who chooses to save lives now and deal with criticism later. Sometimes the hero is the man who dumps massive amounts of powder into contaminated wounds because speed matters more than perfection. Alexander Bogdanovich was that hero. He violated doctrine, saved 847 lives, and spent 30 years afterward treating Brooklyn families as if saving hundreds of Marines was just another Tuesday. Lieutenant Commander Alexander Bogdanovich, 1908 to 1978. Navy surgeon who understood that when the choice is between following rules and saving lives, you save lives first and justify it later.